We're diving into the world of immunohistochemistry to talk about the IgG polyclonal test. This test plays a crucial role in diagnosing various skin and renal conditions. Let's get started. Pre-test information. Before we delve into the specifics of the IgG test, there are a few important pieces of pre-test information to keep in mind. Provide a copy of the histopathology report. First, it's essential to provide a copy of the histopathology report. This report contains vital details about the tissue's microscopic structure and any abnormal findings that could aid in diagnosing. Site of biopsy. Next, the site of the biopsy is crucial. Knowing the exact location from which the tissue sample was taken helps pathologists understand the context of any findings. Clinical history. And finally, a comprehensive clinical history is required. This includes any symptoms, past medical conditions, and other relevant information that could impact the interpretation of the test results. Specification of the test. The IgG polyclonal test is an immunohistochemistry test that detects the presence of immunoglobulin G, Ig, in tissue samples. This is done by applying polyclonal antibodies that specifically bind to IgG molecules present in the sample. The result helps identify the localization and distribution of IgG, which is crucial in diagnosing specific diseases. Diseases associated with IgG polyclonal test. So, what diseases are associated with the IgG test? This test is particularly useful in diagnosing immunobullous disorders of the skin, which are a group of autoimmune diseases that cause blistering of the skin. These include conditions like pemphigus and bullous pemphigoid. Additionally, it is used in diagnosing medical renal diseases, such as lupus nephritis and other glomerulonephritides, where Ig deposits can be found in the kidneys. Specimen used. The specimen used for the IgG polyclonal test is typically a tissue biopsy. This could be a skin biopsy in the case of suspected skin disorders or a renal biopsy when investigating kidney diseases. Components included. The test includes several components to ensure accurate detection and diagnosis. Polyclonal antibodies against IgG. These antibodies are the primary reagents used to bind to IgG molecules in the tissue. Secondary detection reagents. These reagents help visualize the binding of the primary antibodies to IgG, often through a colorimetric or fluorescent label. Control samples. These are samples with a known presence or absence of IgG to validate the test results. Test report time. How long does it take to get the results back? The test report time for the IgG polyclonal test is typically around 7 days. This period allows for thorough processing and analysis of the biopsy samples to ensure accurate results. Test information. Now let's talk about the test's utility. The IgG polyclonal test is often used in conjunction with the IgA test in both renal and skin biopsies. This combined approach helps localize IgG deposits, which is critical for diagnosing immunobullous disorders of the skin and various medical renal diseases. The precise identification and localization of these deposits provide essential information for accurate diagnosis and treatment planning.